discuss anything new, rather to understand why we couldn't do good or couldn't write enough well, secure a pass mark in the exam. So, more than half of the copies have been checked. So, I see like very few pass rates are there. So, to discuss about it, about these questions which is been asking about this the prime regions of the content of the topic which was covered in upper extremity, lower extremity, thorax. So, to start with this answering this thing. So, you know should be knowing how to answer the script. So, whenever you are given this particular exam questions, the long questions, the short questions, they explain why there are different domains of seeking knowledge is there. So, whenever you are given these questions, you have to read it wisely, carefully, and each of these particular questions have got given appropriate marks to answer to it. Now, in anatomy, there are basic way of writing these exams. So, how to write the exam, which is an important essential part. And you have to practice it several times, going through series of logics about understanding of your anatomy and reflecting it that you understand it. So, let us go by this particular content of these questions which you have in the question number 1, which is basically long questions, but you can see that this is broke down into smaller questions, like in a final exams as well. There will be several even more small breaks will be there, 1, 2, 3, 4, etc. will be there. Now, you have to understand, we do not ask you to write the book whenever you are asking something. So, we do not expect you to write the entire content of the what is written on a book, you will be writing and reflecting it, that is not. So, we are basically seeking you, seeking from you is that whether you grasp this anatomical knowledge which is essential for getting a knowledge of the human body, and eventually in the second and third and in a final same exams or same or the professional, you are going to scale up yourself with the knowledge, and so that you can treat this particular individual successfully without harming it. Unless until you know that what to do, what not to do, you are not going to treat this patient well. So, there is an old saying in medical world. What I was saying that thing is that as a good doctor knows how to treat, a better doctor knows where to treat, and the best doctor knows where not to treat. So, you have to know where you can touch it, where you cannot touch it. So, unless until you know this particular human body well, you are maybe indulging in somewhere where you should not be touching or where you should not be treating in a patient like that. So, that thing comes with this particular anatomy knowledge. So, let us explain with this particular content answers whatever I got it from your things like that. In female patients having some kind of lump in the breast, likely this is a kind of like a breast lump which is could be a cause of like the CA or carcinoma breast. Now, this particular individual has a node as well, that means that breast cancers or these tumors have got spreading to these lymphatics. That is why these lymphatic nodes in the axillary region are having some kind of swelling. So, this is a CA breast question and the knowledge of the CA or breast anatomy that we are going to seek in this particular question. Going through that, you are going to understand that, and that actually happens over here. Now, the tricky part is that the question is that the loss of sensation on the medial part of this upper arm of the left arm. Now, this is a tricky part and you fall in it. Now, several times in the class I mentioned it, whenever we mention about this particular sensation that has nothing to do with any blood vessel or any other thing which is related to this particular sensation problem, has to be something with the nerves. And that particular nerves, we have 3 varieties of the nerves. Either it can be sensory nerves or it can be motor nerves or can be a mix of 2, we call them as mixed nerve. So, if you have a loss of sensation to the medial side of the arm, that means which kind of nerves will be damaged? Motor, sensory or mixed. So, either going for this particular sensory nerve or A sensory branch of motor nerve. So, most of the answer we are getting that there is obstructions or something that is going to lead to this particular problem. But you are not mentioning, or anywhere it is mentioning about the sensory deficiency. Now, if you are mentioning about sensory deficiency, what nerve possibly could be suffering or supplying to it? Now we have talked about brachial plexus. In a brachial plexus, we several times mentioned about it. From a medial cord, we have two sensory dedicated branches coming, and that particular dedicated branch we call them as medial cutaneous nerve of arm, medial cutaneous nerve of forearm. Now, what do you mean by this? If you just like break the name, we get this particular medial cutaneous nerve of arm, medial cutaneous nerve of forearm. That means it is supplying the skin. Now, what kind of nerve supplies the skin? It is a cutaneous nerve which is going to be sensory. So, this particular sensations is carried through this particular medial side of the arm and forearm is by these particular two nerves. So, if you have a trouble on the loss of sensation, that means the sensory nerve is not working. So, that particular nerve you have to write it and get the full marks of it. Now, there is a 0 answer on it. So far I have the copies I have checked. Sad side, like there is one individual who have mentioned about medial cutaneous nerve of arm and forearm, which might be likely to be compressed by what? By this particular enlargement, lymph nodes. Why this particular enlargement is strapping on? Because the axillary is a small space, the nerve is passing through that, the nerve is compressed or pressed by this. Nerve is a very delicate and this irritable structure. If you press something on it, it is going to be irritated, and that irritations is reflected as different kind of sensory problems like loss of sensation, burning sensation, tingling sensation, or any kind of problem. Now, if you expect this particular sensory problem which is coming out here is going to be related to this any kind of motor actions. No, it is not going to be a motor deficiencies, because it is a purely sensory actions. So, if your sensory nerve is cut, then there will be a problem related to the sensation problem, not a motor problem. What do you mean by motor problem? Muscular movement problem. That won't be there in this particular individual. Now, for example, if this particular question, same thing was there will be seeing that we are giving this particular thing as a loss of pushing punching action. Now, the same individual, same question, we are projecting it in only the same with the same presentations, and there is loss of pushing punching action of the individual. Cannot push or punch on this particular individual. Now, what could be the problem that time? Key problem of it. So, it is a sensory problem or it is a motor problem? No, I am saying that there is a, forget about loss of sensation on the medial part of the arm and left arm. So, I am saying there is loss of pushing punching action. There will be a motor action deficiency. So, if you have a motor action deficiency in this individual, what could be that particular nerve could be possibly compressed? Long thoracic nerve. Why long thoracic nerve is compressed? So, that is the nerve which is supplying that particular muscle which is doing that particular action, and that particular action is not going to do or not going to perform. That is why you are going to. So, this particular question can be twisted, turned in any and every directions from this particular base question. Unless until you just like understand or grab the concept of it, you are, I mean, every time we change the question, you will be like looking for something new. This is a new question. So, you have to understand that particular concept of what do you mean by this particular element about sensory loss, motor loss, or something like that. Or else you will be just like scattered to every point of life and every point of questions. That is like a Brownian motion, like this is the, this is the, this is the, not understanding the concept is not going to help you. So, whatever the question is asking, seeking you is a knowledge whether you can understand and relate this particular compression of this particular lymph nodes or this lump tissue with this nerve tear. Say for example, I am saying that there is a bluish discolorations of the arm and forearm, same thing, right. So, this particular problem is having this and on the axilla and bluish discolorations of the left arm and hand. Now, how we are going to understand and how we are going to interpret that. So, why it is bluish discoloration? It is a nerve problem or anything else? It is a likely vascular problem. So, it could be an arterial problem, it could be a venous problem. So, it could be a vascular problem. So, how can you separate it out between the venous problem with the artery problem? Then if you have an artery blocked, what will be absent on it? Pulsation will be absent. So, we will be just like giving some kind of things. If you want specifically want to mention about that this particular person have kind of vascular problem, they will be giving some clues additional to it. What we are giving? We are going down to this particular question on to this 4A and 4B. So, explain why kind of question. So, read this particular question B, which is misprinted out here. This is 4B, avascular necrosis of distal fourth terminal phalanx occurring consequence of abscess formations in the pulp face of that particular finger. Now, what do you mean by this particular word, avascular necrosis? So, what do you mean by the avascular? No vascularity. And what do you mean by necrosis? That means it is going to have an erosion, infections which is progressed and going to eat up some of the tissues, that inflammations or that particular disease has progressed. And this necrosis is a kind of problem which basically leads to us is a kind of like a vascular arrest, and that is more of to start with the problem which is starting with this particular blockage of the blood flow and blockage of return of the blood. That means the blood is neither coming and neither the thing which is pulled is not getting back. So, it is a kind of obstructions which is related to it. So, there is nothing to do with nerves out here if you have an avascular necrosis in this particular problem. So, you have to address it properly. So, in this particular question, if you are mentioning something about bluish discolorations of this thing of the medial side of the arm, that has to be something issues with the vascularity. Then we might ask you about something related to the blood vessels, something related to the arteries, what artery is related to that particular region, we may be giving it clue or something. Could be some kind of venous drainage or could be some kind of arterial drainage. So, likewise we are going to frame this particular question and switch to different directions as we want to, seeking whether you understand or grasp this base knowledge or not. Just reading through the books, reading through the lines is not going to help you unless until you understand the concept of what you are learning and why you are learning and what could be the thing why is relation to this particular diseases could be there with this particular problem. Now, next part of these things explain this particular above statement knowledge with this anatomy, then you have to address it. So, then that particular comes with this particular explaining why. So, how to explain? Now, you have to work little bit hard on explaining something. That means they want to know about, dig deep into your knowledge on explaining something. So, for this you cannot just like mention it in here, that won't be appropriate, just mention about this nerve is damaged, that is why this is not going to work, this artery is not working, this muscle is not working. So, you have to explain it with normal anatomical facts, whatever things we have learned, that explains why this medial side is nerve supply having this. It is a sensory supply by this particular nerves which is a cord of branch of which is coming from this, and that particular nerve is supplying the blood nerve supply or cutaneous supply to the medial side of the arm and forearm, and this particular swelling, lymphatic and as well as the lump possibly have compressed on that particular nerve and resulting in the nerve not functioning properly with the sensory functions, and that is why probably have this type of problem. So, we have to these particular three things which you are going to explain it. First thing is normal thing which you are saying that this is what medial cutaneous nerve is doing, then what is the normal functions of the medial cutaneous nerve, and then third thing is explaining what is abnormal with this medial cutaneous nerve is not working. So, you cannot jump into in a one line like this, but again we are just like I am not asking you about write a great detail about it. So, what medial cutaneous nerve of arm forearm is, how it is supplying, second line, third line is this, that is it. And if possible you can just like draw a picture like this and nerve supplying on these parts like this and explaining like this, that is it. And explaining it is a schematic diagram of arm and forearm showing this new cutaneous supply on this side. So, you have to mention that this is the medial side, this is the lateral side. Now, there is a 0% chance losing any marks with this. If you are given 4 marks, you will be getting 4 out of 4. It is just like maths. touch all the domains, you will be getting 100% success. It's possible to score 100 out of 100 in anatomy. No other subjects is going to give that. Proper knowledge, explaining why, and reading this particular content, it gives you 100% credit to it. Then you have this all these things like boundaries and the contents of the axilla. So you have to just like mention about boundaries, anterior boundary, posterior boundary, superior thing which is having got like a apex, it has a base, and it's a lateral boundary, it has a medial boundary, and this particular thing has a content. So we hardly get any of the questions coming with these proper boundaries. So everything, every questions with this is having lackage of knowledge of this particular axillary region and the content which is there. So which is easy for in the axillary artery, axillary nerve, brachial plexus. That's the three content, prime content. So we lack this particular questions over there. Brachial plexus, tons of time we mentioned about this particular schematic drawing of the brachial plexus. Arps point, which is again a disease, which you have to explain it why. What is ARP palsy? So we have to mention about it. It's a upper extremity disease which is involving regions of the deformity in the shoulder region of the affected side, involving the brachial plexus nerves. That's the definitions of it. And then you have to just like a describe about this particular nerve which is involved in it. Upper cord or lower cord nerves is involved in it. Nothing much on it. So what is ARP palsy? That stops there. So you do not have to explain that what exactly happens in there. You have to just like seeking this particular definitions of the ARP palsy, and we stop at that particular time. No need for explaining why this particular things is turns medially or what is called policeman tip or etc. etc. It's not required. It's inappropriate I would say, and it is insufficient to produce all these things which is related to it, because we are not seeking that particular knowledge. Then in short, describe about lymphatic drainage of the breast, which is having a good marks given to it. So you have to mention about what are the lymphatic drainage, tier 1, tier 2, tier 3, draining to different quadrants on axillary domain. What are the different regions, this particular things. So what are the different axillary lymph drainage there? What is the lymphatic drainage from the medial side, inferior side? How this particular things is coming on this particular nipple and subareolar nipple plexus. That's the four quadrant schematic diagram, 4 marks. Again, we are not asking you to write the books on it. Just give a short brief on it. So this is how we are going to address it. Now next thing is that this is with this particular knowledge of your dissection skills. So whether you have attended these particular dissections on this particular region, that particular covers this thing. So you do not have to read it. If you just like flip this particular gluteus maximus muscle under to it, what are the things you are going to see this? So the cutting and reflecting the gluteus max, what are you going to see? So that thing we have to explain, that thing we have to see. So if you are going to see some muscles, you have to see muscles, we are going to see. We are going to see this particular soft tissue structure, nerve, blood vessels, etc. That's it. So that covers this particular whole thing, 5 marks of it. And Trendelenburg, we hardly get any proper explanation as well with the Trendelenburgs as well. So why this particular Trendelenburg is important, that particular things is essential for the testing, we have to mention about. I am coming over here later on about Trendelenburg. This is third questions. Describe about boundary content of the superior mediastinum. Describe in short about development of the interventricular septum. So 4 and 3 is there. So for these 4, so superior mediastinum. So you have to start with the mediastinum, one line. What is mediastinum? Now how this mediastinum is divided? Second line. Third line, boundaries of the superior mediastinum, anterior boundary, posterior boundary, lateral boundary, medial boundary. That's it, and the content of it. And 1, 2, 3, 4. Superior one have got like this to that. That's it. And again, if you miss some of the content, it's not going to harm you or not going to hurt you. The concept with the schematic picture covers these things. Interventricular septum development. So you have to mention about interventricular septum, how did this thing develop? What are the different components of the interventricular septum? 3 sources are there, and this particular interventricular septum, if it is falsely formed, we have a deficiency or gap, we call them as interventricular septal defect, or that particular thing is maybe leading to some kind of or cardiac problem or developmental problem. Foot drop with the fracture of the neck of the fibula. Now you have to explain the things with this detail about this. Thing is that you have a thing, how this particular normal thing is there, and how this particular fracture on the neck of the fibula, to be particular, is affecting that particular normal anatomical morphology and leading to this foot drop. So, we have to explain this particular thing, what is a foot drop, and this particular foot drop phenomenon is produced by fracture of these things. So, you have to know about this particular muscles which are basically lifting this or doing the dorsiflexors. So, what are the dorsiflector muscles that we have to know, that means what is keeping our foot in plane, that you have to know. So, that dorsiflexors are not working, plantar flexors are working. So, what is plantar flexion? The back side muscles which is present on the leg is working. Which one is not working? The front side muscles. That means the anterior leg muscle compartment is not working. Why this particular anterior leg muscles is not working? It could be a possible two causes. Either the common peroneal nerve or this particular deep peroneal nerve is not working properly. That is why this is particular problem having this, and that can be related to this particular fracture of the neck fibula. Why this is related to the neck fibula fracture? Because this have intrigue relationship, it wings around that particular two regions. So, if you have fracture of this, it is going to compress this and going to have this thing cramped. That is what is happening, and that is why this dorsiflexion is absent, leading to that is the thing, flapping. Just like wrist drop, we have this particular in arm, that is happening. Avascular necrosis. So, you have to explain this, why it is avascular necrosis. It is related to this particular blood vessels injury, that blood vessels are going to get cramped because of this excess pressure. So, if we have a blood vessels which is present in this region, that may be cramped. How this particular blood vessels could be cramped? It need really hard pressure. How this pressure is coming over here is a consequence of pulse space infection. That means this region have a tons of pus fluid accumulated, and this particular fluid and pus is pressing over the blood vessels and leading to collapse of this particular lumen of the blood vessels. So, neither blood is coming or it is going back and leading to a stagnant condition, and there is an infection which is again inviting more and more blood tissues which is damaged, leading to this particular avascular necrosis of these things. That means no vascular supply, leading to further deteriorations of this condition. So, this particular normal thing which is happening because of the excess fluid accumulation, in short, in medical words we call them as abscess formation, which is a localized collection. So, it is a pus or which is accumulated in here, and this particular thing, unless until you treat this particular thing with splitting that particular skin, this patient is going to lose this particular finger because of lack of blood supply. So, that is why this is clinically very important, very relevant. Short note on these particular regions, gastrulation. This is again one of the several times, like how many times I do not know, since we were, or even like my super seniors were there, this gastrulation question was there. I think from the inventions of this particular embryology, we have this gastrulation question coming. Neurulation and gastrulation, this is coming from ages, maybe 100 years. If you go back, scan through this particular old university questions, you will be getting 100-year-old question with this gastrulation question or neurulation question. So, this is a layer formation of this particular germ disc. That is the basic thing, from 2 layer to 3 layer, that is the elemental thing. That now we are going through the mobiles, 4G, 5G, 6G. This is about these things which is going to get the superior layers. So, 2 layers to 3 layers, 3 layers has formed. What are these 3 layers? And how this particular 3 layers is formed? In short, there is a pore which is getting into this particular, through the neural pore, it is going to this epiblastales, going down and spreading on, making a separate layer and making this particular ectoderm, mesoderm, endoderm, and with a schematic small diagram that covers all these things. You get 100% answer to this particular response to this particular question, answering this particular element. Definition, at which phase of life it is happening, and what exactly is happening, and what we are getting out of this phenomenon. That is it. 4-liner questions, you get 100% marks with the schematic diagram. Gross feature of interior of the right atrium. So, again, so if you have come to this particular practical classes, then you have just like seen that smooth part, rough part. Just like schematic way, you just like smooth part is called this, rough part is called this. Rough part is because of the musculopectoral. Smooth part is having blood vessels and the wall is smooth. What is opening in here, and what is this particular septum is talking about, and this particular connections which is present in here. So, from this particular region we have this particular thing which is going to these particular valves which is going to be in the next part. So, what is this particular things bringing in this region, and this particular region features of this, and SA node, AV node, if you can just like figure out the SA node positions is fine, okay fine. Just interior to the opening of the superior vena cava, we have a nodal body, we call them as SA node, which is present in the specialized kind of muscle. That's it. So how much time do you have to spend on writing this particular thing? So unless until you write this particular whole thing, you are not going to cover this particular element. So writing in an exam in a proper sequence manner is important, rather very important. Coming to this Trendelenburg, as you are seeing here in the Trendelenburg test or Trendelenburg. What is a Trendelenburg? That you have to just like mention about it. So which is again very important thing. So we have this hip region, and this particular hip is placed uh, in in a normal position or lying in a line, straight line. Careful about explaining it. Understand the normal thing, then explain the abnormal thing. It's not only just like covers this particular abnormal thing, why it is happening and what basically going on wrong into this. You have no understanding on this, you cannot just like say this. This is what again this particular thing we call them as foot drop and loss of eversion. That means we have this particular nerve, common fibular nerve is damaged. That means we have this damage to this particular nerve which is related to this particular common fibular nerve at this particular region, at this particular neck of this thing. So here you have the common fibular nerve. So common fibular nerve splits into two branches, deep fibular and superficial fibular. Superficial fibular supplies the fibularis muscles, so longus and the brevis, which are responsible for eversion of the foot, and the deep fibular which is going to supply this particular muscles which is present in the anterior part of the neck. That means this muscle which is known as tibialis anterior, extensor hallucis, etc., etc. So both of them may be damaged. So this particular thing is going on or happening here, and as well as there will be sensory loss as well. So this particular nerve is a mixed kind of nerve. So this particular lateral part of the leg, lateral part of the foot, lateral side of these regions also have sensory deficiency as well. So this particular foot drop or peroneal nerve, you study it well. So what this particular course of this particular fibular nerve is there? What is the fibular superficial fibular nerve? What do they supply? This, if they are supplying this particular motor deficits will be there. If they are lost, what are the sensory supply to this particular nerve? That will be lost too. So there is a loss of eversion. How this particular loss of eversions will be possible? So next time if you are just like going to give this particular question is that we have an injury to this particular fibular nerve or this particular fracture of this fibular neck, and there is a loss of eversion. So then again you will be in deep soup if you are not understanding or just memorizing this. Just memorizing this foot drop is there because of the fibular nerve injury. If you are not understanding the whole picture, you are not getting the whole things right. So we are just picking up one slice of this particular problem that is happening here if you have fibular fracture. But there could be two components as well. So we are just projecting one, that does not mean that the only thing is happening. In that individual only one thing is happening. That is why we are saying in some individual maybe this particular drop of this foot as well as loss of eversion is there. In a third patient there will be a foot drop, a loss of eversion and a sensory loss could be there. Now how we are going to explain this unless until you understand the base things of this understanding. So we can twist and turn each and every possible permutations and combinations over there, because the human being are not the robotic individuals. They have the individual which is having different kind of presentations. So some presentations will be there like this, some presentations will be something like that, and sometimes maybe just like a whole thing was there. Unless until you understand the whole thing, you cannot catch up this whole story of loss of muscle action, loss of nerve action, etc., etc. So this foot drop is again not that easy thing. And again we can just like give it as a question as gait problem. That means we are saying that like this particular Trendelenburg positive thing, we say that we call them as a Waldering gait. So if you have this gluteus maximus, gluteus medius problem, this particular individual who has a staggering gait or welding gait, you see that the duck how they walk. So we call them as gut deck. So gait which is this individual have like some kind of like have a supporting thing. So the moment the pelvis twists, the opposite side goes on fall. That is why it is always like this. So they have a step like this, they cannot walk like this. So they have to support it on the sides and they walk, because they have this particular balance of this pelvis is tilted in a movement they are walking. So they have a gait issue. So, that particular gait issue may be given with this particular injury to this particular hip region having this kind of gait problem. Injury to this particular neck region of this or upper part of this leg region leading to this particular high steepage gait. So, this particular gait problem which you are seeing here, which is this particular foot dropping or dragging on the foot, we call them as high steepage gait. So, we can turn and twist in any ways if possible, if you understand this particular problem. So, common fibular nerve, what is the superficial position and why this is injury prone? This is in superficial region, that is why it is injury prone, and this is superficially lying on subcutaneous on the around the neck over here, leaving it vulnerable to trauma. So, this particular position itself is prone to have fractures on it. So, that is why this particular region is having fractures or having kind of problem. So, sensory problem, motor problem, what is this particular thing which is having these problems. So, that is what you have to cover, this loss of eversion, loss of sensory loss will be there with this particular problem, having this particular problem. Tibial nerve entrapment injuries, that could be over here, happening over here. This tibial nerve is injured in this particular neck region, but this is again, this is something different and difficult at this particular level. Patellar tendon reflex, you have to explain why this patellar tendon is there, why you are doing patellar tendon, what you are testing basically. So, if you this particular knee jerk is there, which nerve basically you are testing. So, you have to understand this particular thing about this particular different kind of injuries or different kind of explain why kind of questions. Go through this particular explain why questions on the Moore Clinical Anatomy book. It is a very famous book, we call them as Moore Clinical Anatomy book. This is a Bible of clinical anatomy, I would say. So, no such book is there as good as clinical thing is there, we call them as Moore Clinical Anatomy book, M-O-O-R, Moore Clinical Anatomy. You can get a PDF online, it is available, ready to. So, just like there is a big version and a short version of that. That particular book is a Bible for the clinical thing. So, if you get this particular PDF version, you just like read through, you will understand this anatomical concept, how this concept can be related to it. That for that you have to make a study hour 12 hours a day. Right now you are doing this and you are planning to increase it to 1 to 2, but I would say you have to make it 1 and 2. You cannot make it okay 1 plus 2 even. You have to make it 1 and 2 makes it 12. So, 12 hours a day study you have to make it to cover this content of this anatomy, physiology, biochemistry. All right, study, there is no easy escape to it. Study, forget and again study.